Hey everybody, it's Dr. Tucker here from Active Family and Sports Chiropractic. So if you read the caption I have up for our video, this is a question I get all the time. Does acupuncture hurt? Or a lot of people tell me that they're really afraid of needles and so they never want to try acupuncture and just completely not even think that it could be an option for them. So just wanted to explain a little bit and demonstrate the actual needles that we use and explain about acupuncture and what it can be used for. So acupuncture is based off of ancient Chinese medicine theory that the body has its own energy flow and then it flows in certain pathways throughout the body. So I have a friend here to demonstrate that for you. So this is a standard model here, Chinese model, showing all of the meridians. The meridians are those pathways of energy that flow up and down the body, and there's 365 points on the main body, so there are a lot of points. But they're only indicated for certain things, and different points do different things. So when I see patients in my office, usually we're only needling between 10 and 12 points per session, because we really go in, we find which ones are going to be the most effective for different conditions. So the conditions that I see the most often in my office are, of course, low back pain, and headaches and neck pain are pretty common, but we also see some digestive issues. We've had a few cases of infertility, overall stress management. That's one of the things that people say is like the #1 side effect I hear people after they start having acupuncture is that they feel like they relax a lot better and they start sleeping a lot better. Usually that's pretty typical when you're dealing with pain, and then once you start to get some pain relief, your body's able to rest and relax a little bit better. So that's a little bit about those, and I was going to show you what the needles look like. Hopefully you can see them on a video. So this is a package of standard needles that I use. There's 10 in here. So usually this is all I'm using on patients. Just kind of depends on the body area and the condition we're treating with the size that we use. This is a standard size so that we use here in our office. I do have some smaller ones that we use in the ear for auriculotherapy. So the premise behind auriculotherapy is that there's a representation of the body on the ear itself, and so we can needle those points depending on whatever condition someone is having. So I do have an open package of needles here. You can see these are really small. I mean, you can barely see them. If I get it over the picture, you might be able to see it. So the part you see the most right there is actually just the handle. So these are about the size of a human hair. They are solid. There's not a hole going through them. They're not hollow or anything because they're not coated with anything and there's nothing going through it. So if you think of like a needle that gives an injection or that draws blood, that has to have a hole in it for that liquid to get through. And so those are going to be a lot sharper and a lot thicker. So most patients don't feel a thing when they get acupuncture done, and most of them, I've got a couple needles in and I'll ask, how you doing? And they're like, oh, have you even started yet? So sometimes you feel just a tiny little pinch when it first goes in, but then that goes away. So that's just a little bit about acupuncture. Like I said, we treat a lot of different conditions in our office. So if you ever have any questions about acupuncture, you didn't know we did acupuncture, or you don't know what it can treat, just shoot me a message and I will get back to you. See you later.